Perhaps it's not surprising to many of you that the healthcare industry still uses a lot of outdated technology. I have with me now CEO of Allscripts, Glen Tullman, who can talk about why connectivity is really something we need to work on in this particular sector. Now, Glen, where are we headed with this?
Well, what's happening in healthcare is all of us know from our own experience that healthcare today is a paper-based process. So prescriptions, 3 billion of them are written on little pieces of paper that are hard to read. And then all of us are familiar with the big files that doctors bring in. And yet it's the only part of our daily experience that's really paper-based today. Everything else, banking, renting a car, almost anything you do is done electronically. So what we're doing is we're in the midst of a transformation going from paper to electronics in healthcare. But today we're far behind, and that's a big reason that we have the cost and quality problems.
Is there real resistance by the individuals in the industry to really make that change?
Well, I think there's been resistance over the years. We see that going away for a few reasons. One was the cost, and fortunately the federal government has injected $30 billion as a part of the ARA stimulus plan to support the change efforts that doctors have to make and that hospitals have to make to adopt the technology. And the second thing that's really helped is the technology itself. It's gotten better. You know, the advent of the iPad, for example, has really become something that physicians have embraced. And they're saying, if this technology will save me time and save me money, I'm excited about using it. And of course, from a patient standpoint, it's all about safety and quality.
What's the next step, do you think? You mentioned something like the iPad, but are we looking at other technology that's coming online that will really be a game changer?
Well, it's everything. It's from phones, you know, the intelligent phones that people are using. It's the iPads and all of the different tablet formats, and it's also a better user interface. So we have physicians today who are speaking into computers, for example, to write prescriptions, and we have physicians who are doing security using scanning of their veins in their hand and the like. So all the latest technology is being brought to bear on solving this cost and quality problem. And you know, that's the biggest problem we have in the country today, which is how do we address healthcare from a quality perspective and a cost perspective. And our view, Allscripts' view, is using technology to do just that.
Well, tell me more about Allscripts.
Sure.
How exactly is your company involved?
Well, Allscripts is, what we do is we write the software and provide the services to provide physicians and hospitals with the tools they use to process clinical transactions and administrative transactions. So when you think about that, what does that really mean? It's writing prescriptions. It's when you go to see your doctor and he or she actually takes notes about you. It's when they order their lab test. And in a hospital, it's literally running the entire operations of the hospital. That's what our software does. So at one level, it's very complex, and at another level, we make it very simple, because what a physician wants is to see your entire patient record, every physician you've seen, what they did, the medications you're on, and your diagnosis real time. And that's what you want. You want the best health care provided. We give them the tools to do that.
And finally, are providers really smart enough or educated enough to know really what they need in terms of software?
Sure.
Do you have to teach them about that?
Physicians are some of the smartest people in the country today. They're the most competitive, and if you give them technology that works, that has a learnable user interface, and that's important because they're very time pressured, so you've got to give them technology that really works, that's easy to learn, and then they love to use it, and they want the best information to make the best decisions. That's what Allscripts provides.
Terrific. Thank you so much for stopping by.
Thank you very much. It's great to see you.
I'm Mabel Jong. Thanks for watching.